Happy American Pharmacists Month. I'm Mitch Rotholtz, Chief of Governance and State Affiliates at the American Pharmacists Association, and I have the pleasure of being your moderator today for today's webinar. In today's webinar, we're going to discuss ongoing practice stresses and strategies for managing increasing demands from a well-being and a patient safety perspective. With us today as our panelists are Alex Varkey, who is the Director of Pharmacy at the Houston Methodist Hospital, a 924-bed nonprofit academic teaching institution in Houston, Texas. Alex currently serves on the APhA Board of Trustees and is the chair of APHA's Wellbeing Steering Committee. Alex completed his residency training at Nationwide Children's Hospital in Columbus, Ohio, after graduating with his PharmD from the University of Houston and his master's degree in health systems, pharmacy administration from The Ohio State University. Our second panelist with us today is Rita Jew. Rita is Vice President of Operations at the Institute for Safe Medication Practice, Ismp. Prior to Ismp, she had her own consulting business and has held various leadership positions, including Director of Pharmacy at UCSF Health and also Executive Director for Pharmacy and Clinical Nutrition Services at the Children's Hospital of Orange County and Clinical Manager at the Children's Hospital of Philadelphia. Thank you for being with us both, Alex and Rita, for today's great discussion that we will have. Our other panelists that will be participating, our subject matter experts, include Dan Zlot, who is Senior Vice President for Education and Business Development at APhA. And Dan is our clinical specialist and knows all the ins and outs of every virus you can imagine. And so thank you, Dan, for being with us today and for being available to share your insights from a clinical perspective. We also have with us Elisa Bernstein, who's Senior Vice President of Pharmacy Practice and Government Affairs at APhA. And Elisa will also be available to talk to us about any of the advocacy and policy related issues and bring her experience of many years at the FDA to our discussions and questions regarding regulatory affairs. Our format for today is we'll have our introductions as we're doing now. We'll have our discussions with Alex and Rita. We'll have then open discussion where people can ask questions about what we haven't covered or additional questions about what we did cover in our discussions with our panelists. And then we'll review ongoing APhA activities. Before I move on to the next slide, though, I also want to thank the APhA team who has worked behind the scenes of putting together this and now our more than, I think, 55 webinars that we have done during this COVID pandemic. So thank you, team, for all your hard work. So we want to hear questions. So please go ahead and use the question field on the GoToWebinar toolbar. We'll try to get it to as many questions for the audience as possible. You'll also see on your toolbar a handout of the slides and a live link to the resources mentioned during today's program. Before we move any further, I want to give our recognition to the pharmacy teams out there across the country who are making an impact for their patients and their communities. Going over and beyond in this time of pandemic crisis has been a role and an activity that pharmacists have shined. Under the stresses and stretched in resources, they have stepped up and served the needs of their community. And so on behalf of APhA, I would be remiss if I didn't specifically thank you for all that you're doing every day for your patients, for your community, for the profession. And so we also have a message from the APhA Board of Trustees that we'd just like to take a few moments just to show the audience right now. So Meg.
You're here because you care.
About your patients.
About your community.
About your neighbors.
You've shown up from the start.
With few thanks.
Without the expectation that tomorrow will be better.
Because right now,
the world needs you.
You're exhausted beyond tired.
Beyond tired.
Pushed past your limits.
Overextended.
Understaffed.
but you're here anyways.
These meager words aren't enough.
But for today, for right now,
We see you.
Appreciate.
And celebrate what you're doing.
Thank you.
Thank you.
gracias.
Muchas gracias.
Thank
Thank
you.
you.
When technology works. So thank you, Meg, for making that available. So today's webinar has been developed to provide an opportunity to dialogue about the stresses and experiences of the teams who are serving the communities and the healthcare system that is stressed beyond what we've normally experienced in the past and the current demands of COVID-19. No one area of healthcare is immune. And so in our discussions today, we will have an opportunity to talk about your experiences and some suggestions on how to manage those stresses. Pharmacists, pharmacy technicians, and others on the team throughout the profession are stressed and stretched, particularly those working within community pharmacy practice. During this webinar, we will provide information and insights on managing and addressing those stresses in practice. We'll talk about strategies for avoiding errors and hopefully hear from you examples of how you are addressing the stresses in your practices. Through APHA's well-being work, we have provided tools for practitioners in managing the stresses and the stress that they are experiencing. And in particular, we're providing tools and resources to stimulate discussions between staff and their management. As I mentioned in my introductions, Alex Varkey is chair of APHA's Wellbeing Task Force and is the director of pharmacy services of a major medical institution in Houston, Texas. Alex, if you'll turn on your video, jump right there. Thank you. And let's start having a discussion about what's going on and how you're managing it within your practice. So could you tell us about your practice and the work that you're doing to address well-being with your staff?
Absolutely. But before I do that, I just want to echo your earlier sentiments and also the sentiments from the video. And on behalf of the board, just wish everyone a happy American Pharmacist Month. Just recognize the amazing efforts of all of our pharmacists, student pharmacists, technicians, and support personnel in our department, and of course, all pharmacies across all practice settings for the heroic work that everyone's doing to serve their communities. I know that I'm extremely proud of all the work, hard work and dedication that our pharmacy team has demonstrated each and every day, especially amidst the last 20 months of this pandemic. But to your question, Mitch, I think our institution has invested immensely in preserving well-being of its employees. Like most organizations, there may be the free meals and some gifts at work from time to time, and we certainly offered those. But our institution has truly gone the extra mile, and seeing the impact of this pandemic on our workforce, they've invested in providing free access to well-being resources like Headspace, as well as free access to virtual and in-person counseling sessions, even beyond what we had already offered traditionally through our employee assistance programs. And I actually use the virtual sessions myself and have found the service to be extremely helpful. The past summer, our institution prioritized rest and recuperation in the provision of additional PTO and a bonus to provide employees the opportunity to spend some quality time with their loved ones. And we actually just announced this morning, but for Thanksgiving, it was just announced that our employees are going to be receiving a $500 gift card to a local grocery store chain here in Texas to help pay for Thanksgiving or other holiday meals. So we're not only trying to provide resources on site, but also opportunities for our staff to reconnect with family and loved ones. Through the stresses of working in healthcare, they are immense and they are constant. It really is a privilege just working for an organization that prioritizes the well-being of our staff.
That's awesome. That's awesome, Alex. I'm sure you're going to get a nice turkey for that with that coupon. So, being from you're a director of a pharmacy and a significant size pharmacy, how do you view the pressures, the practice stresses, both from a management perspective as well as from an employee perspective? So you're kind of in the middle of a big corporation, so having to manage from up above and then below.
Yeah,
just give that perspective.
For sure. So stresses and its impact on healthcare professionals, that's not new, right? This has been an ongoing issue for some time. It's why past APhA President Brad Tice called for our well-being steering committee to be formed a couple years ago before the pandemic. But COVID-19 stretched us beyond the limits, even more so than what we thought we had before. And it's truly pushed many of our practitioners to a breaking point. I certainly see that here, especially during the pandemic surges in our staff, because the workload is just so large and it pushes us beyond our limits. But I also see it in our colleagues in the community setting, and as you can see on the slide, just the immense pressures that they endure with minimal to no additional help offered to take on these additional responsibilities like testing and vaccinations, in addition to what was already a busy and challenging day-to-day in providing medication therapy management and other services to their communities. You know, as a leader, it's hard to, to see that and to feel that there are certain things we can control and things that we can't. But it's just really important to keep dialogue open and having open conversations with staff to see what the pressure points are and see how we can help.
It's awesome. So, Alex, since you interact with other healthcare professionals in your institution, is there a common approach that you're seeing being applied across the health professions that our audience might use as a takeaway, as something they could look at in their system?
Sure. So we're definitely seeing that, pharmacy is not alone. We're definitely seeing this in our nursing and our physician colleagues, respiratory therapy, radiology, lab. I could probably name all of our departments and it would apply to them as well. Our entire system's overwhelmed. And in the health system setting, we have the opportunity and the fortune of working with multiple disciplines and seeing the challenges and shared struggles. And in some ways, that helps us see and understand that we aren't alone and that there are many others who are being pushed beyond their limits. And it's allowed us in a lot of ways to rally around one another in this common goal of serving our community and our patients. But if I compare that to, let's say, a community pharmacist, though, who may be on their own in their own practice, it would be far more difficult for that extremely hard work practitioner to have the same perspective. Having a sounding board or some sense of community is essential to helping all of us trudge through these immense stress points. And leaders have to be willing to listen to the concerns of their team members and be committed to working together with frontline staff to make any necessary changes or enhancements to help our team. So I think, in summary, just us being able to go through this together has been helpful. And I think having something similar in other practice settings would be very important.
Great. Thank you for sharing that, Alex. APhA and NASPA, through an open process, developed and adopted a document called the Pharmacists' Fundamental Responsibilities and Rights. And the document is also supported by several other pharmacy organizations. So, Alex, can you provide some insight into the fundamentals document and how we can use this fundamentals document to guide conversation about workplace issues?
Of course. So the fundamentals document is an important resource that was developed after months of discussions involving several national organizations, including APhA, to really answer the call that we heard loud and clear from pharmacists and pharmacy personnel that they needed advocacy and help to improve the environments and the conditions which they work. So the document's actually split into two categories. You have responsibilities and rights, but they don't function separately. So we all know as pharmacists, we all take oaths. And so, of course, we have professional responsibilities. And to fulfill these responsibilities, the principles under the rights section are also needed. So our goal is for pharmacists and pharmacy personnel to use this fundamentals document as a place to start a conversation in your pharmacy organization. I'd encourage anyone who isn't familiar with this document to find it on our website and to use it to open the discussion. You may find that many of those rights are already met in your assessment, or chances are you may not. And it's always great to reconcile that with leadership or vice versa and genuinely discuss how to enhance our respective environments. That's always a good idea to celebrate what your pharmacy is doing well and make a commitment to begin to address areas that need attention. When our staff are given the opportunity to be at their best, then our patients receive the best care. So we have to do all that we can to put them in the best position to do that.
So one quick question, and we didn't talk about this earlier, but starting the conversation, one pearl in terms of how do you start that conversation with your management?
I think it really just comes down to, to just creating an environment of mutual respect, maybe even having some ground rules as far as how the discussion is going to be. I think, when you think about what folks that are on the front lines that are dealing with immense pressures may not necessarily feel that they have the support that they need. There might be a fear of retaliation, or there may be a fear of coming forward with something, in case there might be some sort of response that might be further harmful to them. And so you want to be able to establish just an environment of mutual respect between the staff that are constantly dealing with these pressures on a day-to-day basis and the leaders that may be in position to enhance the environment in some ways, make things more efficient to where our frontline practitioners don't have that stress. And so I can't stress enough, just having that open environment for mutual respect, setting those ground rules early is essential to having a fruitful and constructive conversation.
Great, thank you for that. And one of the tools that is often overlooked that are available in a lot of practices and institutions is the employee assistance program. And the concern we hear is if I use the EAP service, will it become known to my employer? Anything from your perspective on the EAP programs?
Yeah, I think I'd say employee assistance programs are likely the most underutilized benefit most employers offer. It's a great way to connect with counselors and other mental health professionals to talk through the tough times with someone outside of your circle and come up with ways to process through those tough times. I think one of the reasons that folks don't take advantage of these programs is that they don't think it's confidential. And I can tell you from my own experience leading our department that I received zero information from anyone unless that employee themselves offers that they are using EAP. And so I don't know if any of our team members are using the resource. It's completely confidential and it's meant to be that way. I think another reason that it's underutilized is that by nature as healthcare professionals and caregivers, we don't think the rules apply to us as far as needing care. And so I can't stress enough that self-care isn't selfish. Self-care is all about sustainability. And we need to work on that stigma that's associated with mental health and not think of our commitment to it being a sign of weakness. Rather, it's a sign of strength and awareness that good mental health means we can be at our best in helping others. And so I would recommend anyone who is going through a tough time and they work for an organization that offers EAP to take advantage of that resource. That's what it's there for.
Thanks, Alice, for sharing that perspective as well. Great perspective. And so one of the things that came out of it, the Wellbeing Summit that was held in 2019, was the identification that we needed documentation to demonstrate the impact of well-being on patient safety and the professional's own mental state. And so APhA and NAFTA recently released a tool called the PWWR. Alex, can you talk about this new pharmacy workplace and well-being reporting portal and how these reports will be used?
Absolutely. So it's important to note that the pharmacy workplace and well-being reporting portal, or PWWR, it's not just another survey. It is a confidential reporting service for your positive and your negative experiences and solutions. And so any report that you submit, it's collected, analyzed by the Alliance for Patient Medication Safety, which is a federally recognized patient safety organization. And so the reports are protected by the confidentiality and privilege provisions of the Patient Safety and Quality Improvement Act of 2005. So any submissions to the PWRR cannot be disclosed or subpoenaed and are not subject to discovery in a legal proceeding. So this offers a great resource for any pharmacist who wants to offer information with regard to current environment and ways to improve that environment. I think over time, it's our belief that the aggregated data from all the reports that we're going to receive, that's going to help tell a collective and powerful story to spark change and improvement in pharmacy personnel well-being as well as patient safety. And I'd highly encourage anyone who is looking to voice their opinions or concerns regarding the pharmacy workplace and well-being reporting tool to submit it, a report on the portal. I think there's something cathartic about using our current mediums like social media to express our opinions, and I get that, but this resource can be really helpful. It's an involved process. Doing a report might take 15 to 30 minutes of time, but it's completely confidential. We don't have, that your name isn't asked for, where you practice, etc. Your report is completely confidential and protected by federal PSO regulations. And then the patient safety organization will analyze reports for trends and then issue reports about those trends as well.
Thank you, Alex. And stand by for questions. We're going to transition now to Rita, and thanks for the insights you provided. One of the ways, as Alex talked about, is the data coming out of such systems as the PWWR. For patient safety organizations, they use it to address system issues through awareness, education, dialogue with system influencers. And the work of Ismp has for years been doing this. And so now we're going to turn our attention to Rita Ju, who is with Ismp. Rita, thank you for being with us, and share with the audience. Tell us about the work you do at Ismp.
Sure. Well, definitely. Thank you for having us, having me today. So I'm a relatively new vice president of operations for Ismp. I've only been at Ismp for almost 9 months, not quite a year yet. And as a lot of you might know, that central to the work of Ismp is our error reporting system. Thanks to a lot of you all out there that has been reporting medication errors to us, we do spend a lot of our time investigating these errors and even calling and talking to our reporters and to understand what the circumstances are with errors happening, and really doing a lot of sharing of these stories through our publications. And most of you might have read either our acute care newsletter or our community / ambulatory care newsletter, and some of our other publications that we're really sharing these errors and also providing our recommendations for that. When we see errors happening over and over again, or series errors, we also send out the NAN alerts, like the NAN alerts that we recently sent out about the mixed up of COVID vaccine and flu vaccines. So that's really central to the work that we do, besides a lot of education and consultation work we do at Ismp.
Thanks, Rita. And so, let's focus the discussion now on with increasing workplace stresses, as Alex had talked about in our previous discussion. Tell us about some of the most common safety reports coming into Ismp, especially those that have been heightened during the COVID pandemic.
Well, I have to say that during the COVID pandemic, one of the largest number of reports we have gotten are really COVID-19 vaccine errors. We have all kinds of errors being reported that I would never even be able to imagine in the past, just because of the huge volume of vaccines that folks are administering to patients. Leading the errors are dilution errors. We have errors that are both causing underdose and overdosing to patients. Too much diluent, too little diluent, no diluent. And because of the way some of the mass vaccination centers are operating, we have people who's trying to be proactive in preparing the vaccines and drawing up air ahead of time, and hence sometimes mistaken as diluent in a syringe, that air actually getting injected as diluent into a vial of Pfizer vaccine, for example, that causes overdose of the vaccine. We have errors on mixing of two components vaccine, and with COVID vaccine, the Pfizer vaccine specifically requiring a diluent, we have wrong diluents being used, still water instead of normal, or again, no diluents at all when air was injected into the vial. We have storage issue, very notably at the very beginning of the COVID vaccine rollout, we have mixed up between the antibody, the COVID antibody vials with the COVID vaccine vial because of lookalike. We have worked really hard with the FDA to try to correct some, and the manufacturers to try to correct some of these issues. We have administration of the wrong vaccine to the wrong patient population, administration to the wrong age patients, and especially with the second doses mixed up with different doses of vaccines, one vaccine given versus the other. Like the patient was supposed to get, has been getting Moderna vaccine, ended up getting the Pfizer vaccine, or vice versa. Second doses of Janssen vaccine being given to patients when it's not required. And then the most concerning one actually are the shoulder injury related to vaccine administration when the vaccine is being administered too high up on the arm and causing shoulder injuries. We have quite a few of those reported to us. And then, of course, if you go to the next slide, the most recent issues are the mixed up between the flu and the COVID-19 vaccines. And we thought a lot of these reports were actually coming from the consumers. So we couldn't quite figure out what was causing these errors. So a lot of this are speculations that we do believe that because there's an increase in demand of co-administration of both flu and COVID vaccine, this is one of the reasons why there is all this mix up. And a lot of times we also realize from talking to folks that these syringes might be stored right next to each other. We've seen unlabeled syringes after the vaccine doses has been drawn up, and when you have these unlabeled syringes around, that could easily be mixed up. And distraction is definitely one. We have a report that was telling us that the patients were talking to the pharmacist as the pharmacist was administering the vaccine, and the pharmacist got distracted and ended up giving COVID vaccine instead of flu vaccine to a patient. And I think topping the list is really staffing shortages, that the pharmacists and technicians are pulled in so many different directions, and everything is so rushed that is causing these mixed up with the flu and the COVID vaccines.
Thank you, Rita, for sharing those insights. And we've already got some questions that are rolling in. So one that I while we're on this topic is the reports that are coming in for the errors. Are they only from dealing with pharmacies, or are they across the healthcare system? Are you seeing errors occurring in other practices?
Yes, the errors that we receive are from across the board, like from acute care hospitals. I mean, no one is immune to these errors, unfortunately. We have hospitals reporting the errors, similar errors that we're seeing in community or retail pharmacies and chain stores. It's across the board, basically, in mass vaccination clinics and physician offices. Those are all the reports that the locations of the reports that we are getting. And these errors really was not discriminatory as far as the location of practice.
Okay, great. So the question is in terms of what the manufacturers are doing to help avoid some of these errors. And so what are the manufacturers doing to prevent mix-ups with the COVID vaccines and other vaccines?
Well, I think the most notable things these manufacturers are doing is the different color caps, right? You all know that by now that the adult Pfizer vaccine is purple in color, and the pediatric vaccine that's coming out is supposed to be orange with orange caps. The Moderna vaccine is red for both the regular and the booster shot, and the Janssen vaccine is blue. So these color differentiation is good to a certain extent. I really do want to stress the importance of folks not completely relying on these colors to differentiate these vials, and make sure reading the labels and ensuring that you're having the correct brand of the vaccine is very important. And one thing is, of course, sometimes you get these colors mixed up in your head as well, and you assume, I mean, confirmation bias is such a real thing, especially when you are busy and you're stressed and you're stressed out. The other big thing is once the cap is removed, you would not have any other differentiation. So you can only rely on the caps for a fresh vial, and once you tap into the vial for the second and the third doses, you wouldn't have the cap color too for differentiation. So it's really important that we don't over rely on color differentiation in this case.
And I think one of the points that you and I talked about when we were prepping for this is not relying on the color, always read the label and double check. So going back to our basics that we learned in pharmacy school about double and triple check.
Yep.
So let's talk about some practical solutions that pharmacies can put in place for preventing errors. What suggestions do you have for pharmacies in order to avoid some of these potential errors?
Well, having a standardized procedure is important. There's quite a few different things that as at Ismp we actually recommend. First of all, separating your vaccines in clear bins that would differentiate one from another is important. Yet now that the Pfizer vaccine is coming out with the pediatric dosing, that's even more important. For a long time, we've been recommending with vaccines that you always want to segregate the adult vaccine from the pediatric vaccine, because we've seen over the years errors of administering the pediatric vaccine to adults and adult vaccine to pediatrics all the time. I mean, even every month we get a ton of numbers of these kind of reports out. So definitely having good storage system to segregate these vaccines is important. I know in the community setting sometimes it's a little difficult to advocate for the labeling of these vaccine syringes, but more really these days when you have all these different vaccines that are not in the pre-filled manufacturing vaccines that they can differentiate one from another, labeling the vaccines is an important thing, even if you do have some pre-printed labels just to kind of slap on the vaccine syringe after it's prepared is an important way to prevent errors from happening. For some of the vaccines where they have pre-filled manufactured dosages, we always encourage using those instead. So for example, between the influenza vaccine and the COVID vaccine, one way to help differentiate it is to use these pre-filled manufactured flu vaccine syringes instead of pharmacists having to draw it up. One person at a time one person preparing and administering the vaccine do help with some of the communication issues that we have seen when one person draw something up. Some of the injecting air into the vials, frankly, is someone was preparing these syringes for someone else's to draw up, and the person to come by just didn't realize that it was just air in the syringes and thought it was already drawn up diluent, and ended up putting it into the vial and not diluting these vials. So if at all possible, if one person would prepare and administer it, at least they would be able to know what the different steps are. We wanted to make sure people are doing one thing at a time and not doing an assembly line of things, because that's really when errors happen. So one patient at a time, one vaccine at a time. And of course, two things that I cannot stress more is the double checking, the independent double check. This is almost a luxury sometimes when I see in the retail stores where things are so busy when there may only be one pharmacist around. But these are the critical steps that a second pair of eyes is important. We have always advocated Ismp, and me personally, even when I was in practice, is really doesn't matter who is drawing up the vaccine, a second pair of eyes is important. So if a pharmacist is drawing up, your technician can help to do a double check, and even your clerk, if you don't have another technician around, to help to do the checking to make sure that you don't have a lapse in your memory, or you don't have happen to have confirmation bias pulling one thing up for another. And then finally, we really wanted to advocate involving your patients and or parents for pediatric patients or caregivers, and really having them validate the vaccine, read it out, have them hold up the vial or the syringe label and read it out. This is what you're getting, to confirm that. So then you have the patient helping to confirm that the vaccine is indeed the correct vaccine.
Great point, Rita. Thank you for sharing those. And another one that we know that also helps too is if you're pre-filling out their COVID cards, for example, before a person administers the vaccine, double check the card as well, what they're supposed to be getting,
Right.
what's put in the system and what they're supposed to be getting. And again, as you say, confirm that with the patient. Great points. Thank you. Anything else in terms of things that have created errors that you want to leave a suggestion to the audience?
I think standardizing your workflow and make sure that everyone is sticking to this standardized workflow is important. I mean, in pharmacy, we know we've all been practicing is one pharmacist might do one thing compared to another. And when you don't have a standardized workflow, that's usually when mistakes happen. So if at all possible, if you can have one standardized workflow and make sure that you put in your double checking in that standardized workflow and clearly outlining who are the people who can help with the double checking, I think will go a long way in helping to prevent some of these lapses that happens when folks are stressed out and stretched.
Okay, great points. And Alex, if you'll go ahead and join us back on the screen. Thank you, Rita, for the insights, and we'll go to some of the many questions that have been coming in. So let's start and let's see, which one do I want to jump to first? Okay. So one of the questions, and I don't know, Alex, if you want to draw on this or not, or someone else, and Dan, if you're on, if you could join us as well. You know, how can pharmacists address patient anxiety and aggression that's been heightened during the pandemic in the pharmacy while maintaining a safe workflow? I know you're in institution settings, but any suggestions in terms of, even when you've done community outreach programming, how do you manage patients who are just impatient?
Yeah, well, I mean, that's definitely a challenge. I think that many practice settings are seeing, certainly our community colleagues, we're seeing it in our setting as well. You know, our health system has administered over 950,000 doses of COVID vaccine since last December. And we see a variety of situations, you know, whether patients are either impatient with the process because there's just so many competing priorities that a practitioner is having to deal with. And so, you know, I think, you know, one of the things that we've been just trying to do is just come across as calm as we can in conversation, just explain what's going on. I think with lack of information, people create stories, right? So if you know, if your patient is there and they don't know what's going on, they're going to create a story that someone doesn't care about them or someone is not prioritizing them. And so continuous communication has been really helpful for us in just helping our patients know where they're at in the process, you know, from when they park in our parking garage to when they're in line, to when they're, you know, getting ready to receive their vaccine, when they're in the monitoring area afterwards. We try to be in continual communication with them just to help put them at ease and answer their questions.
Okay, thank you, Alex. Another question that has come in is a lot of anxiety is created by the ever-changing protocols and recommendations. How do you suggest that pharmacists keep up with those changes and reduce their stress levels?
Well, I could take a stab at that, I guess. One of the things that we recommend is having someone, if you're in an organization where there are a bigger organization, definitely having a designated person always checking with the CDC website and the FDA website, and especially with a lot of emergency use authorizations, they keep changing, right? So you definitely need to have a dedicated personnel trying to keep up with this information and communicate the information to the rest of the organization, and making sure that only the most updated information is on your website or on, you know, on your intranet for resources for folks. So, and trying to make sure that you have one area where you post all the information so you can update it and remove outdated information. I know it's easier said than done, but definitely I'm a big advocate of not having too many places where these information are, because when it comes to updating it, especially these days and age with information changing just on a regular basis, it will be impossible to remove outdated information if you have it in like 5 different places, for example. Alex, I don't know. I'm sure you have other insights in the practical world, right?
Honestly, you're right on. I wouldn't have said it any better.
So one other suggestion I would have for an answer to that question is, APhA is spending a lot of time trying to keep up with all the changes and trying to get the information out in a timely manner. So I'd encourage the audience to look for those emails, go to the website that APhA has, because that's where the most current information is going to be placed and sent out through our various communication vehicles. So you want to make sure that you're on those listservs that are receiving that information. I see Dan just got on. Dan, you want to add anything on that?
You took the words right out of my mouth, Mitch.
Okay. Thanks, Dan, for staying here. And I have a question for you that came in too from a participant. Is it has to do with do you have any tips on how pharmacists can manage the threat of infection when they lack sufficient workplace social distancing? Pharmacies can be small, and so what are things that the pharmacists and their pharmacy teams can do to at least reduce that risk to themselves as individuals?
Absolutely, it's a phenomenal question and one that we all have to deal with. So a couple of things that come to mind, and they're obvious things, simple things like if you're in close proximity to others, wear a mask, minimize the spread of airborne contaminants, airborne droplets. That's going to be a major role in containing interperson spread. Another big piece, simple things like hand hygiene, right? We're all touching things in the pharmacy all day long and we're all touching the same things. So the more often you can clean your hands, sanitize your hands, the more often, the better everybody will be. Additionally, beyond that, another thing that I think is really important as well is if you're not feeling well, don't come into work. I know I'm personally guilty of coming into work when I've not felt well in the past. I've made a conscious effort since the start of COVID to not do that. I feel bad leaving work for my colleagues, but you have to understand that if you bring in something to your team, you can take out your whole team. So really acknowledge that precaution, take that extra precaution. Where possible, and I know it's not always possible, take advantage of work from home opportunities so that you can distribute your workload across multiple geographic locations and minimize that. So those are a few small things that you can do that will help minimize the spread and maximize your opportunity to protect yourself from COVID. And like I said, I know I didn't say anything new or novel there, but those are all kind of the things that we always remind ourselves.
General question here. Has anybody have anything to add on that? Okay. Have we had any insight onto whether a person who has had COVID-19 and 2 Moderna shots, if they need the booster?
I'll take a stab at that one, Mitch, and then you can jump in and let me know if you've heard anything differently. At this point, I don't think we have enough information, particularly around people who have actually had COVID-19 and COVID-19 immunizations about whether or not they'll need boosters. And then there's a lot of other subtleties there around the risk factors. Are they immunocompromised or not? And so there's a lot of gray area there. So at this point, I'd say no definitive guidances that I've heard about, and no specific data that I've heard about for specific cases like that as well. Mitch, anything to add?
Yeah, I have to go back to the actual clinical guidance that was released earlier this week just to see if they particularly address this particular question. But there's not a contra that I'm aware of if they've had COVID on boosters, but I need to look at that more in detail in the clinical guidance because there are some nuances in there. You may have heard even with the immunocompromised patients, now they could get up to 4 doses. And so that's a difference in there as well. Again, that's a different situation than we're talking about, but I would refer, and I think get somebody from the team to put in the resource page the link to the clinical guidance that gives more insights into some of these questions. Okay, somebody who's on the call just listened to the Pfizer webinar and just wanted to make people aware that there is a version of the Pfizer adult vaccine that will not be needing a addition of a diluent, but that really won't come out until after the pediatric vaccine has been out there. So again, they don't want to confuse the market with another additional, but again, that's adding some other products to the mix. And so I want to go back to Rita a second. And Rita, in terms of the storage of vaccines, can you go back and reiterate, how do you recommend that pharmacies handle how they are positioning the vaccines? What are things that they should not put next to each other, or put at a distance, or put specific flags so that there's not an error as all these different versions of vaccines come out?
Right. So if at all possible, we recommend that the pediatric vaccine be far away from the adult vaccine. So especially now with hopefully just one pediatric vaccine for COVID, then you can just store it at a different shelf, just way like 2 shelves away from your adult vaccine will be good. But I think the other big thing to note too is that the reconstitution instructions will be different. I mean, the amount of diluent that you putting into the pediatric vial is different. So it's very important that there are specific instructions. And Michael and I were just talking about this as this new pediatric vaccine is coming out, and we're like, we guarantee that there's going to be errors being reported saying that pediatric patients are getting adult vaccine and vice versa. So, I mean, having probably early on having instruction cards on your bins for your vaccines, 2 different vaccines, as folks are preparing them, that they can take it out and refer to them on a regular basis will be important. And I would say that this is where we had a long discussion about, okay, maybe the cards are just, the instruction cards are only needed at the beginning when people are not used to the pediatric vaccine. And I would advocate that people use the instruction cards on a regular basis, not relying on memory. And your pilot, when they're flying your plane, will never skip their checklist because they say, oh, I've been flying this is my 200th time, so I don't need to go through my checklist, right? So always referring to that instruction card will be a good practice to do to try to prevent yourself from having some of your confirmation bias and just forgetting that you may potentially be thinking about the adult vaccine when you're really preparing the pediatric vaccine. Those are all kind of important things to think through and have those standardized practice that we talk about.
Thanks, Rita. And on the slide, we've just put up an example of this. Look at this as a counter or a top of all the different type of vaccines you may have out there in preparation at some point. You could have vials in here. So some watch outs we want to make sure you're aware of, and Rita touched on this on several of them, is that on the Moderna, we know there's the booster dose and we know there's the regular dose. One is at 0.5 mLs, one is at 0.25 mLs. So the reminders for your head, don't try to remember it in your head, as Rita said. Use reminder cards and double check the doses again, 0.25, 0.5. Keep your pediatric vaccine separate, as Rita said as well. And if you're doing, vaccine clinics, especially as the pediatric vaccines are going to be rolling out, do separate times that all you're doing is pediatric. So there's no chance of any kind of mix-up between that vaccine and even the regular Pfizer vaccine, because that, as Rita said, has different diluent that you're going to use. You're going to use 1.3 versus a 1.8 mLs of normal saline. You're going to give 0.2 mLs for the pediatric versus 0.3 for the regular. So those are just reminders that you want to put in place for yourself. Don't rely on your memory to remember which dose, what diluent there is.
Yeah. I can stress enough of that, not relying on your memory. I think as a pediatric pharmacist, we learned early on that the doses of the pediatric doses are so variable that in different age group might have different doses or dosing interval. We have learned early on that we always go back to the drug information sources to double check before we would confirm a dose. And I think this is kind of that practice that we wanted to instill in everyone. The there's so many different COVID vaccine that's out on the market now, and they're all different with volumes and dilution of diluents that's needed and all. And it really we should not be trying to be fast and commit this to memory and not refer to our reference source. So that's a very important, a key message that I want to make sure everyone gets.
Thanks, Rita. And just give one last chance for any of our panelists, any closing comments for the audience. Okay, I want to thank you, Rita, you, Alex. Thanks, Dan. And I want to call Lisa Bernstein to come on screen to share some advocacy updates from APhA. So Lisa, it's yours.
Great, thanks. What a great discussion. Thanks to both of you, or all three of you. Yeah, just a couple of updates for you today. As you are mostly I'm sure most of you are well aware that an FDA advisory committee a few days ago recommended the vaccine for kids 5 to 11. It has not yet been authorized by FDA, and still also has to be authorized or recommended by CDC and ACIP. So those meetings are still in the works. So despite any pressure you may get from parents, hold off from giving those vaccines to children 5 to 11 right now if you want to get the protection, the liability protection afforded under the PrEP Act. And the PrEP Act is the law that authorizes pharmacists to provide vaccines, tests, and COVID-19 therapies. So, but it all depends on authorization by FDA and recommendation by ACIP and CDC. So hold off for that. So that's just some advice, because we're hearing a lot that a lot of pharmacists are getting pressures from parents to give their children the vaccine now. The other, so once the pediatric vaccine is behind us, the next thing to look at is the oral therapeutic, which is likely going to be considered for authorization very shortly as well. And that's something I just wanted to give you a heads up on that. APhA is very focused on that already, looking at the reimbursement issues, the distribution issues. So stay tuned at future webinars where we can give you some more information on where that is. Let's go to the next slide, because so last week it was all about boosters, and I wanted to share with you some amazing resources that APhA has developed and has on the website. And one of them is an algorithm that really looks at, okay, so what does my patient get? There's first doses, there's boosters, they had Pfizer first, they had Moderna first, they had J&J, what's next? And this algorithm walks you through in one page the question and asks you questions about what they got and what they should be getting, and are they eligible for a booster, a third shot, what that dose would be. So really helpful. We have this on our website at pharmacists.com, and on the next slide there is a link to get to that resource as well as other resources. Another one that we most recently updated is a summary chart that has all the different vaccines in one chart, including the doses. And it also, we also just posted some frequently asked questions about booster shots. So all of that is available. Those links are active. If you click on, or I think they actually just put it in the chat. So these are really helpful, and you should also bookmark the COVID practice resource library, because we are constantly updating that website. So back to you.
Thanks, Elisa. And one more resource to add that we've also just updated. It was the chart or the diagram that we issued on Friday after the last recommendation release. We've now updated it with the booster recommendation in terms of the additional doses for those who are immunocompromised after the clinical guidance came out. So there's an update to that. So look at that as well. We've got a lot of good feedback from folks in terms of the usefulness of these tools and that diagram to try to help. As somebody said earlier, we need something to help sort through all of these different recommendations. And again, these are examples of what APhA is trying to put together to help you deal with all the information coming out. And so besides those resources that we also have some upcoming educational programming that is available to you, including the booster dose pieces, new CE on that from both Moderna and from Pfizer, as well as multi-dose vial technique. We've got a training video on that now, reminding folks on the Moderna vaccine that the maximum number of punctures that you should be doing into a vial is 20 punctures. And so how do you optimize what you are able to draw out of those vials without contamination and leakage? So that's a tool as well available to you as well. Then next slide, please. Again, encouraging you to utilize the Engage platform to share questions and information between your colleagues. If you have a question, Engage is a great place to put that question for guidance from your colleagues. Next slide, please. So our next webinar will be on November 11th. It will be a CE program that's available. The topic is on COVID vaccines in the pediatric population. And so it'll be, again, November 11th, and registration will be coming soon. Today's webinar will be available, recording will be available at the link you see here on the screen, and it'll be in our open forum library that's on the website. On behalf of APhA and our members and leaders, thank you for what you do every day. Thank you for taking time to participate with us today, and happy American Pharmacist Month. Have a good day. Be safe. Thank you.